Three.
Welcome, everybody, to our psilocybin-assisted addiction recovery talk, models of care and facilitator skills. And if you aren't familiar with the work that we do, then let me tell you that psilocybin-assisted addiction recovery is one of our main specialties at Transcendence Retreat. And while we do a variety of services, this is our primary specialization, and I'm gonna let Rose tell you a bit about how we do it and what we do. And I hope that you find a lot of value in that, and hopefully it can help you in some way. So I'm gonna turn it over to Rose, who is our uh, director and, in my opinion, our best facilitator. So Rose, thank you for being with us.
Thanks, Prema. I'm the founder and program director of Bodhi Academy, and I came to work in the psilocybin services arena based on my decades of work as a addiction recovery and trauma recovery specialist. I'm a former counselor and also the founder of Transcendence Retreat, where we do work with addiction recovery. So today I'm going to present a little bit of an overview about how to use psilocybin as a part of recovery. And our host, Prema, will be around and putting some links in the chat for you to access more information about our programs. I just pull up my prepared content to share with you. So as I was saying in the introduction, I began my professional career as a licensed addiction counselor and a specialist in traumatic stress, the treatment of traumatic stress. And I was attracted to becoming a counselor because of the original studies that had happened in the 60s and 70s regarding the use of psychedelics for mental health reasons, especially for addiction recovery. So I founded Transcendence Retreat and Bodhi Academy in Oregon when Oregon became the first legal state offering psilocybin services. And our company is now expanding into Colorado, where our addiction recovery retreats will be held, including our landmark 30-day psilocybin assisted recovery retreat program for addiction and trauma. So I'm happy to share with you today some important elements of psilocybin services that we need to incorporate whenever we're working with clients who have addiction issues. We're going to look into some of that past research that I just referenced because it was amazing results that they were getting back in the 70s around using LSD for addiction, specifically alcohol, but they looked into some narcotic addictions as well. And then we're going to talk about the present research and the key elements of the experience that have been analyzed out based on looking into the actual experience that people had, and that's called the peak experience. And then we're going to talk about additional considerations in screening addiction recovery clients and how to prepare them, what to expect in preparation, what to expect in the actual psychedelic experience, things that are commonly seen with this population, and then additional considerations for integration of the experience afterwards. So a little bit about Bodhi Academy. Psilocybin services will, of course, become the main focal point of mental and physical well-being. emotional well-being going forward. So our training program is really designed to support practitioners and professionals to effectively incorporate psilocybin into their existing practice and to master the art and science of natural medicines, which are very different from anything that we have seen in the mental health arena previously. All of our faculty members have decades of experience with natural medicines and psilocybin specifically. We all were pioneers here in Oregon using our decades of underground experience and expertise in supporting the rules around the use of natural medicines. And then all of our team members, both at Transcendence Retreat and Bodhi Academy, were among the first to receive state licensure as psilocybin facilitators. And we're now among the first getting licensed in for natural medicine facilitation in Colorado. We have so far assisted more than 100 journeys through legal access programs in Oregon and Colorado. And we do focus at Transcendence Retreat on trauma resolution, addiction recovery, emotional grief and loss, and we're really big on cultivating the peak mystical experience for lasting change, which is why I find the research that we're going to look into really compelling. So we'll start with the past research. This is a scene from the Spring Grove Hospital LSD experiments, which were conducted in the 1970s. The last experiment at Spring Grove with LSD took place in 1976. These are some of the research articles that I would suggest that you look into, and I can email everyone on the registration list this same list of studies so that you can look into them. What all of these studies really found was that bringing LSD, or in some cases psilocybin and LSD, to the clients, patients that they had who were experiencing addiction resulted in either resolution of addiction or in people having vastly reduced episodes of drinking. So similar to what we're finding in the present day studies. But I do want to highlight that in the last article referenced here, the 1962 treatment program for alcoholics in a mental hospital led by Sven Jensen, he was giving multiple LSD sessions and then a psilocybin session, then 3 more LSD sessions and then a psilocybin session. And they ultimately came to determine that the psilocybin was more effective. So they stopped using LSD in that study. And it was a long-term process. They had people inpatient at first, and they were there for 30, 60, 90 days. And then they were also continued the psychedelic therapy after they got out, so that the longest, it was one of the longest studies, and they found at 18 months still very significantly reduced rates of the use of alcohol. A few of these studies became very well known, including the Pank study that we see listed here, Walter Pank and Stan Groff and Kurland. Some amazing article on the experimental use of psychedelic psychotherapy. And of course, that was featuring LSD. And we're going to look at some of the highlights from that in context of the mystical experience, because what has been said about addiction recovery from the 1930s, when the first Alcoholics Anonymous groups got established and people started really looking at it as a compelling compulsion, and some, of course, it had a lot of baggage on it back then about how it was a moral failing. However, they pointed to, in the big book, which was published by AA all those decades ago, they pointed out that the psychedelic the the cure for the alcohol addiction, or the thing that would most change that cycle and that pattern, was the spiritual experience. So the clients had to have a spiritual experience, and then that would resolve the addiction or the cycle of addiction. So that information was already there. And then we come into these experimental studies, specifically the Walter Pank study, experimental use of psychedelic psychotherapy. And I'm going to pull some highlights from that up for you in a minute. Current research, we're seeing the same patterns. This Vandermeer article on the therapeutic effect of psilocybin in addiction, it's a systemic review. So it references current research, and it also references all of those research articles that I just shared with you a moment ago. I think the most well-known current research is from Bogenschutz et al., called Percentage of Heavy Drinking Days Following Psilocybin-Assisted Psychotherapy versus Placebo in the Treatment of Adult Patients with Alcohol Use Disorder. And this clinical trial in 2022 showed that 83% of people who had heavy alcohol use at the level of addiction, diagnosed alcohol use disorder, 83% had a big reduction in the days of heavy drinking. And they only did a 12-month follow-up, but even at 12 months, they still found I believe it was 63% of the participants actually had a far less amount of time with heavy drinking. The ZIF analysis of psilocybin-assisted therapy in medicine is also a collection of a variety of studies related to addiction and the use of psilocybin to alleviate that issue. And then I also put here a Robin Carhart Harris article that is just really compelling in so many ways. And we refer to this article quite a bit in the full training for Bodhi Academy, and it's called Psychedelics and the Essential Importance of Context, because I want you to know that it's not the psilocybin alone that brings these results. And when we're dealing with clients with addiction issues, the context is very important, and the additional supportive care that can be provided in that context is equally important in actually achieving resolution. And it takes far longer. And I'll say this about the past research: they immersed people in treatment modality. They were either in an inpatient setting and they were there for 90 days, or sometimes they were in retreat settings, and you would see these really long, they called them experiments back then. We know it as clinical research now, but the clients or the participants would get immersed in a flow of therapy interspersed with psychedelic sessions, and they would be 90 days or 4 months or 6 months at sometimes. And the study I referenced previously was actually went on for 2.5 years. Some of the patients in that program continued to come back for psychedelic sessions. And I really want you to understand that we do have a 30-day retreat program for clients in recovery to come and have psilocybin sessions, along with coaching and counseling and other supportive community modalities of care. And they have psilocybin sessions, strategic times throughout their time with us. And that isn't the end of it. A proper course of treatment or a proper course of recovery programming that would lead to resolution would be for them, after that 30 days, they have a psilocybin session once a month for 12 months. And that's considered a clinical course of treatment with psilocybin. So it isn't a one-time thing or two times. The longer you can engage people in a therapeutic process with the psychedelic, with the right context, the essential importance of that context, meaning they're getting motivational coaching, motivational interviewing, consciousness coaching, a program that they can work on, community support, peer support, along with the therapy, any medical needs that they might have. We try to address the whole person throughout the course of that year. And the psychedelics are scheduled, the psychedelic sessions are scheduled strategically to support them to continue to deepen their process. One thing that our clients often comment on is the depth of preparation that they received and the depth that they were able to go to with the support of the psilocybin. You know, if we think of the cyclic nature of post-trauma syndrome and we think of the cyclic nature of the addiction syndromes, it's pointing to a default mode network in the brain that's very entrenched. And we, in the Bodhi Academy training, obviously, we have a lot more depth of training around the use of psilocybin with addiction and trauma that goes deep into the neuroscience aspect. But for our purposes today, we can think about the brain being stuck in the default mode network of addiction or the default mode network of the trauma cycle. And the psilocybin disrupts that. And then the deeper layers that are the root of that cycle start to come forward. So obviously that's not a process that's going to be resolved in one or two sessions. This is going to be an ongoing program for people and an ongoing container for support. This is the peak experience that, you know, can also be referred to as a spiritual experience, an awakening, a unity consciousness experience. But it has that sense of a divine event happening. And these statements come from that article that Walter Pank, Stan Groff, Charlie Savage, all those great pioneers who conducted this research and published this article in 1970, they highlighted the mystical experience or the peak experience as being the critical change factor for the clients that they had who incorporated psychedelics into their addiction recovery process. So this sense of unity, losing the separate ego, losing the dualistic awareness of us and them, you and me, and coming into a more unified state of awareness is part of that experience. So these are the hallmarks of a mystical or peak experience: the sense of unity, transcendence of time and space, you know, going beyond the world of light and shadow into a place of deeper understanding. They deeply felt joy, peace, and love. They have a sense of awe and reverence and wonder. And they gain very meaningful psychological and philosophical insights. They gain oftentimes imagery. I'll give you an example. I have one of our addiction recovery clients who's enrolled in a psilocybin assisted recovery program on an ongoing basis had a journey or pretty early on in the process, you know, during his retreat, and saw an image of a boy desperately trying to get attention and trying to get let in to a compound that was gated. And he was seeing it from the perspective of the watchtower within the compound, and no one would pay attention. Since that journey and that vision of that boy, this image has come back over and over and over throughout the course of his ongoing growth and evolution. When he gets in a tough place or he gets triggered around things that would drive him to drink, he's learned to think about that boy, think about the boy craving attention, and to pay attention to that instead of the craving for the alcohol. He brings it up quite often, like this happened today and I knew it was the boy at the gate. That would have maybe taken years, decades of therapy. And honestly, this person has been to treatment 23 times and still would return to drinking over and over. Even though he doesn't really want to drink, he wants to be sober. It's this thing that has been out of his control. And underneath the layer of that cycle of drinking and going to treatment and going to sober living and then drinking again was this kind of a process deep within him, the boy at the gate crying out for attention but can't get in. And he's learned to work deeper within himself because of that psychedelic experience. There's also a sense of ineffability, a difficult, the thing was so big, it was so immense, it was so wonderful, it was so divine that I can't even put it into words. So these experiences take people beyond mind, beyond language, and that is an essential part of how and why they transform. This is a Beckley Foundation analysis of the Imperial College of London study on treatment-resistant depression. You probably are familiar with this study. You can find it online at the Beckley Foundation website. These are the people who responded, meaning they all took psilocybin, and the responders had a greater than 50% reduction in their depression. Some of them had a 83% greater, like they resolved it. It was not a factor anymore. This is long-term treatment-resistant depression. And this is at 5 weeks after their journey. They were still having significant reduction of depression. The non-responders didn't really have a sense of relief from all of their depression. They might have had some insights, but they still were very depressed. And so those were the non-responders. Now the purple line here shows the types of mystical experience that the responders had. And this is significant for addiction as well, because as soon as people come off of that drug and they get through the withdrawal, they're depressed. There's a depression that's been there the whole time. So it's a feature of the whole syndrome of substance use and dependency. So you can see that the responders had a greater score on the mystical experience questionnaire around the experience of unity, the spiritual experience, a blissful state, insightfulness. They were slightly more disembodied. Disembodiment by itself is not always a mystical experience, of course. People can dissociate as a coping mechanism, but you have to take into account the whole picture. They had a greater audiovisual synesthesia, meaning their senses were mixed up. They were hearing colors and seeing sounds. They had more elementary imagery, like the client I was referencing. He had very clear imagery and visions of various things within him. And they had more complex imagery. And then they had a change in the meaning of percepts. So they had a change meaning about how they viewed themselves and how they thought about themselves. They also had less anxiety, significantly less anxiety. Now, there's a whole variety of things that can happen or not happen through the preparation process. And I don't know that all of these researchers who are studying these things actually understand the depth of preparation and the impact preparation can have. But we know from our experience that preparation can include certain key factors that will make it much more likely that someone will have a mystical experience. And we teach that as part of our program too, how to cultivate the mystical experience. So the greater the mystical spiritual experience, the more the healing happens and endures. And I think that's a very important thing to bring out. Our program and our faculty are very consciousness based, and we're really focused on the power of human consciousness to go beyond the limits of this struggle that we have and the existence that we live in. There's more to the world in the invisible realms that we don't know about, that we can experience if we approach psychedelics in the right way. All right, those are some of the things that you have to take into consideration when you're preparing clients who are seeking psilocybin for addiction recovery. Of course, we do very thorough screening. We do very in-depth preparation coachings. We help them find meaningful intentions. So just for the purposes of our workshop today, I wanted to highlight on the left side things that we would want to look more carefully at if they show up on a screening. So any kind of co-occurring disorder. It's not unusual to see bipolar and addiction together, or schizophrenia. Any of the psychotic disorders or active psychosis is kind of a red flag for, don't take the psychedelic right now. They would need to have more careful evaluation and support. Now, there are some studies that are beginning to look at psilocybin for bipolar or psychedelics for bipolar and schizophrenia. And there were many previous old studies in the past that were done. We even had one on the list there back on the slide about past research where they studied schizophrenic and non-schizophrenic alcoholics and the impact, if any, that LSD would have on them. And they ultimately stopped following the patients that were also diagnosed with schizophrenia because it wasn't really, they weren't getting anywhere near the results of the non-schizophrenic people with AUD. So these are cautions because psilocybin can aggravate psychotic disorders and make them worse. And I've seen that happen. I've seen people with bipolar disorders who take a psychedelic, maybe it's ayahuasca, maybe it's DMT or LSD or psilocybin, and they go into an extreme manic process afterwards. Sometimes it's very life destroying. So you want to be very careful around bipolar, schizophrenia, and active psychosis, and don't just rush into giving them a psychedelic. That it often can make things worse. There's certain personality disorders that can also be made worse by psychedelics. That would include potentially borderline personality, although there's a lot of debate about that. It certainly, in some cases, seems that it makes it worse, but in other situations, there are practitioners who believe that it's just a matter of having again that the right context for folks with that struggle. Narcissistic personality also is aggravated or made worse by psychedelics. There was an interesting chat going on LinkedIn a few days ago among practitioners saying, people with NPD come out of the psychedelic experience saying, well, I'm God and I'm the best person to give this medicine to other people now. And they were expressing, legitimate concern that this is something that we need to watch out for. So in our work, we have set up some screening. We've had help from psychologists and therapists to set up some screening for NPD. It can be very subtle and it can be very hard to pick up on, but and especially with addiction, you have to differentiate between the grandiosity of the addictive cycle that we see displayed, where people are in denial and they're defensive and they seem very self-centered and determined to do what they want to do. And that's a different thing than a narcissistic personality. So we need to really have a good team of people to work with these folks so that we can get clarity on these various manifestations of psychology. People who are suicidal or having self-harm are signs for extra caution. Go slow, have additional input from counselors or psychologists around that. Now, there are studies that show that psilocybin will reduce self-harm um, in some cases. So, but it's not like, huge numbers of people over long periods of time. You want to be very careful that you help somebody get past these this level of depression where they are having actual thoughts of not just suicide, that I don't want to be here, but going beyond into I'm actually having a plan of how I would do it. Those are people who need extra attention, and self-harm is the same way. We need to pay attention to that and see if we can help resolve that before giving the psilocybin. And then last on here is withdrawal symptoms. We do have people who are actively consuming alcohol or drugs. They must go to medical detox. Withdrawal can be a life-threatening situation, and people do die from withdrawal. So we have interventionists who work with people to help them go to detox. And we don't always take them into our programs right away after detox, because detox is like 5 to 7 days, but withdrawal from a lot of substances, including alcohol, can really take months. On the other hand, we've had urgent situations where the client had been using drugs and alcohol for decades and also had died from overdoses. I think he had died 4 times and been brought back. And he could barely stay in a detox center. They would often kick him out because he would become very angry and belligerent. And so we sent an interventionist to work with him, and his family was just desperate. They had sent him to treatment 10 times. They had really lost their son 4 times, and by a miracle, that it wasn't his time to go, he was brought back. And he wondered about that, when he came to us. He was thinking, why didn't I die? Other people die from 1 overdose. Why didn't I die from 4? So when he arrived, we had to take him pretty much out of detox. So he had 5 days, and he was only using alcohol at that time. You also want to be aware alcohol is contraindicated with psilocybin. It can increase the risk of substance-induced psychosis. People can become dissociated, derealized, depersonalized. If you remember the pilot who tried to take over the plane and then told people he had taken mushrooms, he had actually, the night he took the mushrooms, he had been with a group of friends. They were at a kind of memorializing a friend who had died, and they consumed a great deal of alcohol, and then they passed around the psilocybin, which he had never taken before. And he experienced derealization. Like after that, he would have these episodes that would come on where he would feel like this isn't real. I'm not in reality. And that is common with combining high amounts of alcohol with psilocybin. So we want to be sure that, and then that was what happened to him on the plane. He was like, I got to go home, even though he knew he was derealizing and that it was disturbing. He didn't get help for it. He just got on the plane. And then on the plane, he had an episode of derealization. So that isn't something that you would commonly see with psilocybin alone. But when you mix it with alcohol, it increases the risk for those kinds of events to happen during a psychedelic experience. So when it comes to withdrawal symptoms, you want to evaluate to make sure that they're past any kind of life threat. But sometimes they need to take the psilocybin sooner rather than later. So we have a whole team of people that evaluate clients. And in this case, we said, let's just have the interventionist pick him up from detox and bring him straight to the program. Because his parents were saying the minute he gets out the door, he's going to either go buy alcohol or he's going to get opioids. So the interventionist brought him, and when we picked him up from the airport, he was pale and sweaty and he had tremors, alcohol tremors from withdrawal. and I was manicky and all the symptoms that he was still in a very acute phase of withdrawal, even though the life threat had passed. So we brought him to the retreat, and the next day we gave him his first session. And during that first psilocybin session, the facilitator observed that the tremors, which were really strong at the beginning, as he started to integrate the psilocybin and get into the peak experience, the tremors stopped completely and they never came back. And the client was amazed because he felt so different. And I really believe this is the impact that psilocybin can have on the neurological system. But it was quite amazing to watch the withdrawal just end in that one session. And I don't know that that would happen with everyone, but it was significant and it made a huge difference for him. So clients who have current long-term extreme SUD, AUD should be given an ASAM criteria. So they should be evaluated according to ASAM criteria, which is alcohol, substance abuse, medical evaluation. And we have people on our team that are trained in the ASAM, and this will give us their entire history. We'll get to know all the different substances they've used, how long they've used them, how much they use. And again, if it's current use, they have to go to medical detox before they consume psilocybin, just for safety, for their well-being. Our job as psychedelic guides and facilitators is to reduce harm. And our program really trains the people in it to become a harm reduction expert. There's many layers to psychedelic harm reduction. So we always have them evaluated first. And then if it's within your scope of practice as a guide or facilitator, it's good to do biopsychosocial spiritual assessments. I added the spiritual because they always call it biopsychosocial assessment. Knowing what we know about the mystical experience, it's important to do that spiritual assessment as well, to help plan out the client's program. Like maybe they're physically okay, their biological health is okay, and maybe their social life is okay, but their psychology and their spiritual dimensions are in need of attention. And that starts to help us formulate what should this client what might they want to focus on in their psilocybin sessions. Motivational interviewing skills are also really important for addiction clients, to help them complete all of these different processes that we want them to go through. But also, there was a study done at University of New Mexico, where they just used psilocybin and motivational interviewing with people with alcohol addiction, and gave them psilocybin, and they had very good results from that study. So motivational interviewing is something that helps the client identify their own motivation for change. These assessments can be abbreviated and brief, or they can be thorough and lengthy. It really depends on what each individual needs. But these kinds of assessments, evaluations, and interviews give us very important information that allows us to plan in a way that ensures the safety of the client with psilocybin specifically. These clients can be very sophisticated at manipulation, which can impact their expectations, hopes, and motivations. It happens commonly now. People read the headlines and they think, oh, great, I'm going to be my best self ever after one psychedelic experience, but that's not the case. And then depending on the information you get, you'll be informed, do they need more coaching, more therapy, or other support to get ready for the experience? These are important preparation considerations with addiction clients. Can they accept advice on the dose? Because we're going to have a kind of a structured approach to doses. A lot of times people with addiction think more is better. However, it's important to know that the client who has multiple types of addiction and has great tolerance for those drugs that they've been using or the substances they've been using may not have the same tolerance for psilocybin. For example, the young man I just mentioned who had a long-term opioid addiction as well as severe alcohol addiction, his tolerance for alcohol was very high, but he needed very little psilocybin to have a very powerful experience. So they don't equate. So you need to evaluate that. You want to know what additional support do they need? What context are we going to create? Do they need a safety plan? What underlying conditions or tendencies do they have? Are they able to moderate substances? And even if somebody is heavily addicted, once they get through withdrawal and they're not using, they often have more ability to moderate. And what is going to be the safest setting? So this young man I referenced, he was very volatile. He had, I believe, a sort of a rage disorder underneath it all, and he had tremendous anger, which is, I'm sure, what he was trying to suppress with all these substances. And it was better for him to be in a setting that was out in nature, out in the country, where he couldn't just, run out the door and hit the bar, but also where he could calm down. He could go outside and be on the earth and be in nature and feel more grounded. The mindset is important. We know setting, dose, and guide. Those are the four most significant factors in creating safe, effective, and settings and experiences, but also in reducing harm. So when you think about a person with an addiction, you don't think of surrender and being okay with not being in control. So this is something that we really need to assess with these clients and help them practice things that help them surrender and not be in control. We also look for resistance, anxiety, fear. That anger was probably also covering up a lot of fear. We want to know ahead of time what might come up. And then we want to use coaching and other techniques to help improve their mindset to get them ready for the experience. They might also have triggers because they've been to treatment so many times and they feel like a failure, and now they're coming to do something else, and they tend to put that in the same box. And we've seen that in every client that we've had, because they've been to treatment so many times with no lasting results, and they believe this is going to be the same. And we don't use a cookie cutter model like treatment rehabs use. Everybody fits into one box. We're very individualized with each person that we work with. So we're not the same, but they tend to get that feeling that, oh, here we go again. So you want to address that too. How do we guide the administration session once the client is with us and takes the dose? So psychological distress and behavioral escalations are much more likely with clients who have a addiction history, and often they have a trauma history underneath it. So we use a co-facilitator model. We always have two facilitators. This is the same model they use in the clinical studies, but it's also very important in the event that they do need de-escalation. You have to be prepared to use those de-escalation techniques, which we also teach as part of our training. We want to have, if they're in a group, and we often see people in groups, we create a separate space near the group that we call the safe space, and that's where people can go if they're feeling overwhelmed or very activated, so that it doesn't disrupt the rest of the group and we can work with them more one-to-one. Another good way to de-escalate is to accompany them outdoors and let them be in nature and lay down on the ground to, reground themselves and de-escalate. You're going to also see a fair amount of emotional dysregulation with these clients. They may have very high emotions with little ability to tolerate those emotions. They're not able to objectively view themselves, and they have the fight, flight, or freeze response because their autonomic nervous system is quite heightened and impaired from everything they've been through. Addiction itself is trauma. And if they don't have underlying childhood trauma and other kinds of trauma, like military veterans or emergency responders who turn to alcohol for that trauma, they certainly have the trauma of having been living in a state of addiction for so long. And they can have extreme mood swings, and their coping skills and self-soothing skills may not be very strong, and they can also be prone to dissociation. So these are the things that can be heightened during a session with the psilocybin, and having co-facilitators and backup facilitators is really important. But the most important thing is the depth and quality of training that our facilitators receive. So in integration, on the other side of these powerful experiences, there are different special considerations for folks with addiction issues as well. They're going to need probably more integration sessions than a client who just wants to see what it's like or wants to have some personal insights or spiritual experience. They're going to need a lot of integration because the sessions will bring up so much content that they've never faced, that they've been covering up with the addiction cycle. Those underlying layers of the cycle begin to come forward. So typically we keep them in an integration process for 6 months or more. And again, we have that protocol that we encourage them to undertake, a session a month, every month, while they continue to be in a program that provides the context of recovery. And from time to time, we want to reassess recovery markers and progress, engage them in safety planning during the integration phase. People can come out of the experience overwhelmed or depressed, or they might feel unsafe in some way. So we want to be sure that we incorporate a safety plan for integration. We want to make sure that if we don't have a team of people that can work with them, that we connect them with referrals to the right support. And then we want to talk to them again about the benefits of additional sessions. This is a good start. You've got into some things that you haven't faced before, and this is a good time for the commitment to happen that you will continue a program in a container, whether it's recovery coaching, integral consciousness coaching, transpersonal work, counseling, whatever it looks like, but that you will add a psilocybin session minimum once a month for a year to that context. And then be sure that the client has the contact information for psychedelic crisis hotlines if needed. People can have reactions to the processing, and there are some very good psychedelic crisis hotlines out there for everyone. So I think that we covered a lot in a short amount of time, and I want to invite you to ask questions if you want to unmute, and if you want to go on video, you're welcome to do that. Ask any questions that you might have about what you just learned, and then we'll talk a little bit about our training program. Anyone have questions? Okay, well, this workshop has been recorded and will be available for replay if you want to go through and take additional notes. So I'll welcome back Prema, our host.
Thank you, Rose. I thought that was extremely informative. I enjoyed it. I learned some new things, even though we discuss these studies all the time. So thank you for that. And I'm going to tell you a little bit more about our Bodhi Academy program, which of course is led by our team of expert faculty that includes Rose and myself, as well as Sienna and Anthony, who, if you haven't met, I encourage you to see if you can come on and meet us another time, meet the rest of our faculty at another event. But thank you, Clint. Thank you for the compliment. I agree, it's great stuff. So, our leading experts that I just mentioned are experts in the field of legal psilocybin services. We have helped to build the nation's first legal system in Oregon. And as Sienna was saying the other day, we cut down the trees to build a road into unknown territory that hasn't been explored before. So we're pioneering the space, and we draw upon our combined decades of experience and expertise in the supporting in supporting the use of natural psychoactive medicines. Our team were among the first in the world to receive state licensure in psilocybin and natural medicine facilitation. And since the launch of legal access programs in Oregon and Colorado, our team has delivered more than 100 professionally guided journeys to individuals, couples, and groups, with our particular special focus on trauma resolution, addiction recovery, emotional healing of grief and loss, as well as cultivating peak mystical experiences for lasting change. Psilocybin services will play a key role in the future of emotional, mental, and physical well-being. Our training program is designed to support professionals to safely and effectively incorporate psilocybin facilitation into their existing practice and to master the art and science of natural medicines. Bodhi Academy's curriculum has been created by facilitators for facilitators. Our program offers an in-depth curriculum that meets and exceeds legal state standards for licensure. The curriculum perfectly balances the wisdom of traditional consciousness-based uses of the sacred mushroom with leading-edge research and clinical applications. Our practicum program alone provides 100 hours of in-depth, supervised, direct care training in individual and group preparation, administration, and integration practices, as well as 50 hours of consultation and mentoring with our esteemed faculty. So overall, the program includes 150 hours of video and live synchronous training, regular integration sessions with faculty, a wealth of clinical and academic articles that have been carefully curated to cover all of the important elements of psychedelic care. You also get supervised practicum sessions, regular assessments throughout the program, sample forms you can use to launch your practice, specialty training in designing and managing programs and retreats. We have a focus on effective dose ranges for micro, midi, and macrodose sessions. You get faculty hours for one-on-one consultations. We have guest faculty presentations from leading experts in psilocybin and exclusive content derived from hands-on experience in delivering legal psilocybin services. We have our own case studies that we conducted of a variety of client presentations and experiences, plus the weekend intensives featuring supervised role plays and demonstration sessions. We have a focus on clinically proven, evidence-based psychedelic harm reduction methods and techniques. And of course, we also have our 100-hour supervised practicum training, which essentially is a 10-day in-person retreat in the beautiful Rocky Mountains of Colorado. And we also have a review of historic research, as well as the latest clinical studies and findings, plus tools and techniques for preparation, facilitation, and integration, including indigenous and clinical approaches. We also offer training in-depth coaching with a special focus on integral consciousness and transpersonal theories. And I have to say that last piece is a personal favorite of mine that most programs don't include, and I think it's extremely synergistic and one of the absolute best approaches to combine with psychedelics. Our cohorts are limited to 24 people to ensure individual attention and build community, and we have several seats remaining. You can reserve your place by completing the enrollment application form that I'm going to put in the chat. Enrollment is open now, and it's closing on March 18th, and the program will begin on March 19th. So let me grab this link so that you can...
While you do that, put the links in there, Prema. I just want to tell those who are watching the recording that the links are also in the description below the video.
Yes. Okay, great. So
if you have any questions about Bodhi Academy, you can connect with me on the link to schedule a call with me. I would love to hear more about why you're interested in the emerging field of psychedelic care. And if you have any particular questions about our program or any of the work we do, I would be happy to talk to you about that as well. I also want to mention that we're hosting information sessions every Wednesday. And so next Wednesday, you can sign up for the information session. And on Friday, February 28th, our next workshop is going to feature our associate faculty and certified sound therapist, Rachel Foxfeather Doherty. She's going to present a workshop on sound, music, and psychedelics. She's really quite expert at combining psychedelics with sound and music, and she's also very knowledgeable about all the playlists. She teaches the neuroscience of sound and music in our training program, and she's quite amazing. I think her workshop is going to be just great. And then on March 7th, Sienna Terranova and I will be back to provide additional training in healing trauma with psilocybin, something that she and I also specialize in. Our program is very comprehensive, and you see here the website. You can take a look at the website to see the schedule, details on the program, and information on the faculty, as well as a video that was made at our 2024 practicum retreat that I think will give you a really, the real feeling of Bodhi Academy. So thank you all for being with us today. And I hope that you'll join us again for future workshops. You can check us out on Eventbrite. Just look for Bodhi Academy Psychedelic Facilitator Training for all of our events. And look forward to seeing you in information sessions and other workshops coming up. Thank you, Prema, for hosting us today.
thank you, Rose. It's a pleasure.
And we'll see you all next time.